Hello, everyone. So, there's been a lot going on recently with the whole pandemic narrative and pushing vaccines pretty hard these days. So, we're going to get into some of the recent CV-19 news. So, here we've got CNN with a headline from December 3rd. Vaccination cards will be issued to everyone getting COVID-19 vaccine, health officials say. So, Bill Gates has mentioned having the vaccination certificates before, that we're going to need those to travel, and most everything Mr. Gates says comes true conveniently for him in his agenda. So here we have, now they're rolled out vaccination certificates. So here's the picture: COVID-19 vaccination record card. So vaccination cards will be used as the, quote, simplest way to keep track of CV-19 shots, says Dr. Kelly Moore. She's the Associate Director of the Immunization Action Coalition, and they're supporting the frontline deployment of the vaccine that's going to save everyone. At least that's what they want us to believe. So anyway, vaccination certificates. For people who support freedom, like freedom to travel, and people who might not want to get a new, relatively untested, rushed vaccine. Most vaccines take 4 to 10 years to develop, and this one took 10 months. So, there's reasons why people might not trust that it proven safe, despite them saying that. But anyway, it says here, she's a good doctor there, Dr. Moore. She says everyone will be issued a written card that can be put in their wallet. It's going to tell them what they had and when their next dose is. Let's do the simple, easy thing first. Everyone's going to get that. So it's simple, just a little card, just puts down the dose. You're going to need 2 doses, of course, they've been saying. And well, the interesting thing about this is that another reason they're claiming they need this is because there's going to be lots of vaccines. There's going to be Pfizer, there's going to be Moderna, going to be AstraZeneca, and so many more. So it says here, every dose administered will be reported to the U.S. CDC. So the reason this has to happen, at least one reason this has to happen, is because of the multiple doses. You have to get 2 doses, but they have to be from the same vaccine. So this is going to help keep track of that. Nothing about, surveillance or anything. Nothing about needing the certificate to have to sit down in a restaurant or anything. Not in this article, of course. This is just the simple thing to do, guys. Of course, it goes on to say that these images released by the DoD, the image of the card there, they come as Pfizer and Moderna await emergency use authorizations in the United States. So a panel with the U.S. FDA is expected to discuss whether to authorize them on December 10th and 17th, and probably going to get approved. Already, Pfizer got approved in the UK. Already, apparently, the first person has been vaccinated with the brand new experimental vaccine. So it goes on to say the first shipments could happen December 15th and 22nd. So coming pretty quick, and everyone's going to be getting this nice, handy little vaccination card. Some might call it a vaccine certificate. So this is from August. This is from the National Geographic. So let's see what they have to say about the coming vaccines. This was, like I said, all the way back August 19th. So headline: COVID-19 vaccines could become mandatory. Here's how it might work. Now, I've always argued they're going to be mandatory, but not by executive order, not by law. It's going to be enforced by the corporations. And this is exactly what the mainstream media is saying. So it says, after a COVID-19 vaccine is available, you might need to get inoculated to go to the office, go to work, attend a sporting event, go to a football game, go to a baseball game, or even get a seat at a restaurant. How would that work? Well, they're going to explain it to you. You walk toward the arena, ready for a big game, tickets in hand, but what you see is a long line wrapped around the corner of the building, and a bottleneck at the entrance as people search their pockets and purses for a small piece of paper. That's apparently, at least for the time being, it's going to look a lot like this right here. Interesting. To be cleared to enter, you'll also need that document, which will be, here it is, proof that you received a CV-19 vaccination. This is the future, as some experts, such as Bill Gates, Dr. Fauci, on down the line, this is how they see it. A world in which you'll need to show that you've been inoculated against the novel virus, so-called virus, to attend a sports game, get a manicure, go to work, or hop on a train. So, I thought maybe some people would be interested in that. The mainstream media is not talking about this anymore now that the card's here, but this is what they've told us the card's going to be used for, and now the card's here. Another thing that CNN didn't mention, really important, probably going to be more than just a card. See, it says here, this is an article I wrote on my blog on Hive. Operation Warp Speed morphs into military intelligence tracking surveillance program. And that's public over a month ago, I think. So, let's see if I can find it here. There should be... Oh, okay, here it is. So, Mr. Slaoui, Moncef Slaoui, the vaccine czar, Trump's vaccine czar, he, at the time, it was recent interviews with the Wall Street Journal, New York Times, he said that millions of Americans... Well, the millions of Americans who are going to receive the vaccine, obviously about 50% polls indicate are not going to. So, anyway, the half of Americans or more that receive the vaccine, or however many actually get it, that are going to be distributed under Operation Warp Speed. That's Trump's rushed vaccine program. It's a military operation, has been from the get-go. Will be monitored via, quote, incredibly precise tracking systems, and he also described this tracking system as a very active pharmacovigilance surveillance system. Officially, according to the vaccine czar, this program will ensure that patients each get 2 doses of the same vaccine, like I was mentioning, and to monitor them for adverse health effects. Wait a minute, I thought the media's been saying it's a safe vaccine. Why would we have to monitor them for adverse health effects? Good, very good question. CNN won't ask that question. They won't even talk about any of this surveillance system. Meanwhile, it turns out that Google and Oracle, big tech, have been contracted as part of this tracking system to, guess what, help collect and track vaccine data. So my guess is going to be a little bit more than a card. Probably going to be a whole database. CDC declined to comment on such a database, according to CNN. But rest assured, if it's not a CDC database, it will be a big tech database. We know Google's been working with the military. They were both of these companies actually were links to the CIA. So, I don't know for certain, but they're telling us out in the open that this is what's going to happen. And they're going to be tracking this data. They're going to be tracking it. Big tech's going to be tracking it. So you can bet it's going to be more than the little card in your pocket. But the usefulness of the card is to be able to hand it over when you want to go sit down in a restaurant. No card? Don't have your little card here? Oops, sorry. No dinner. No entrance, just like masks, just like I've been saying. So vaccines are coming, but there's other news. They really want you excited about the vaccine. Hope for America. Gonna save everyone. Gonna stop the deadly virus that hasn't killed anyone more than any other year. Yeah, same number of people per capita dying this year as died last year. Nothing special. If it wasn't this virus, it'd be another virus. So anyway, but it's going to save us from that horrible, deadly virus. But first, this is news headlines. Vaccine is coming. But first, long, dark winter. And then here, that's Baltimore Sun, Chicago Tribune, on down the line. COVID vaccines are coming. But first, a long, dark winter. So expect the vaccine to come save you. But first, it's going to get worse. Has to get worse first before it gets better. So that's kind of the programming that's recently been going on. This is from the 1st, December 1st. And then here's New York Times headline, pretty much the same. Vaccines are coming, but pandemic experts expect a horrible winter. Same thing, but dark winter. They've been warning it. Dr. Bright, he first warned of this dark winter in May. If you haven't watched my most recent video before this one, I get into that. Bunch of clips about the dark winter. It's definitely they've been prophesying this dark winter for a long time now, and it's probably not the people who prophesied are making it happen. It's probably just a freak coincidence that they all just knew all the way back in May when the first wave was kind of going away that there was going to be a second wave in the fall, and sure enough arrived just when they said, and then a dark winter, and sure enough dark winter's arriving just like they said, and they just happen to know everything about this brand new virus that no one really knows anything about, but all these experts, they know everything about it, so probably just a freak coincidence there. But you hear for yourself, Biden and others.
We're about to go into a dark winter. A dark winter. There's a need for bold action to fight this pandemic. We're still facing a very dark winter. There are now nearly 10 million COVID cases in the United States.
So it goes on and on. That's a clip from my dark winter video. But so we're about to go into a dark winter, about as clear as you can get there. And then here, see if I pull this up. So then on Sunday, last Sunday, so a week ago now, we had on Chris Wallace, Fox News, had the Surgeon General. And he's going to ask him also about this dark winter, playing right into the narrative. And it's interesting what Dr. Adams responds, Surgeon General. So listen here.
New cases Friday surpassed 205,000, and that was breaking a record set the week before. Hospitalizations were at record levels in a number of states, including Oregon, Washington, Indiana, and Pennsylvania.
So just like Biden, it's all about this huge number of surging cases, and that's why a dark winter is coming. So he's about to ask now.
Pennsylvania. So I guess the question is this what a dark winter looks like? Is this what a dark winter looks like, or do you forecast that this is going to get worse in coming weeks?
Well, I want to be straight with the American people. It's going to get worse over the next several weeks, but the actions that we take in the next several days will determine how bad it is or whether or not we continue to flatten our curve.
Flatten our curve. You gotta love how they're still talking about flattening the curve. What, 10 months later after they first, if anyone recalls, 15 days to flatten the curve, all the White House officials were. And here we are, what, months later, almost a year later now, and they're still same White House, and not White House, but same federal officials telling us to flatten the curve by doing what they say. Apparently doing what they said a year ago didn't work, so we just gotta keep doing same kind of stuff. So yeah, it's gonna get worse though, and others have said that over the summer. It's gonna get worse, dark winter, gonna get worse. So obviously, narrative, of course, it's gonna get worse, but we can make it better. He wants you to know, just some action. So he's gonna masks. He wants you to wear masks, just like Biden wants you to wear masks for the first 100 days. Just 100 days, guys, not forever. Just 100 days, just over 3 months. That's all. So that's what he's really getting to. He's going to talk about the vaccines coming to save the day too. But remember, first, before the vaccines come, long dark winter.
And right before Thanksgiving, but I also want people to know there's hope. We are mere weeks away.
Hope. The vaccines gonna bring America hope. We're just weeks away
from starting to vaccinate the vulnerable, and we can significantly protect people who are at risk for this virus. So hang on just a little bit longer.
Guys, just hang on, just wear your mask for just a few more months. Get through this. We'll weather this dark winter together, and then we can all roll up our sleeves and get that brand new RNA DNA altering vaccine injected into our arms. Took only 10 months to roll out. It's gonna save us all. Don't lose hope, guys. Wear your masks.
Understand that the science out there has never been stronger to support the wearing of masks. You shouldn't have to have a out there has never been strong. Just a little bit longer. Understand that the science out there has never been stronger to support the wearing of masks. You shouldn't have to have a mandate to do the right thing, to protect your neighbor, to keep schools open.
Okay, so that's just pretty funny. The science has never been stronger to wear masks. We shouldn't need a mandate, guys. Just do the right thing. Which, of course, when they say do the right thing, what they mean is do what we tell you.
Make sure you're watching your distance, and make sure, again, if you've been in a gathering of more than 10 people without your mask on over the last several days, please get tested in the next 3 to 5 days.
Please get tested. Same thing they were saying back in April. If we just get tested, if we just wear masks, if we just stay at home. Didn't seem to work then, but it's going to work now, apparently. Going to hold us over just a few more weeks, just a few more months until the vaccine is widely available.
But what I want people to know is moving forward, again, the science is never been stronger in terms of what we can do. Simple, powerful measures.
Yep, simple, powerful measures. So he's talking about masks. Gotta wear the masks. It's about to get real funny here.
And wearing a mask is an instrument of freedom. It actually will let my kids go to school. It will protect my mother. And you and I talked about this before the interview. My mother's in the hospital right now. And wearing a mask is an instrument of freedom. And wearing a mask is an instrument of freedom.
Wearing a mask, guys, is an instrument of freedom. Being forced to cover your mouth, dehumanize yourself, wear a muzzle, restrict your oxygen flow, restrict your breathing from the way you're naturally created to breathe. But it's an instrument of freedom, guys, because it's going to allow us to reopen in 3 months when the vaccine arrives. Makes so much sense. But here's the interesting thing that I think is really most important. Let's go back to the internet here. Oh, it's got to reload. Sorry about that. But here's the Surgeon General. Same guy, Dr. Adams. This is in February. Seriously, people, all caps, stop buying masks. They are not effective in preventing general public from catching #coronavirus. But for some reason, if healthcare providers can't get them to care for sick patients, it puts them in communities at risk. But they don't work, but they work for some people. So that was February, March. Dr. Fauci was saying the same thing. No reason for Americans to be wearing masks. And he later retracted. He didn't retract it. He said, please wear masks now. And when he was asked about it, he just straight up admitted. He said, I lied. I lied because we needed the healthcare providers to have the mask. But Mr. U.S. Surgeon General, he doesn't say he lied. He actually makes up a whole spiel about it. Here, and is it June? Yeah, April. Updated guidance in April. So he's going to correct his mandates, I guess, his recommendations. He corrects himself because we continue to learn new things, he says, about the CV and strive to update all accordingly. So let's just hear him update. This was linked from the tweet here. Let's just hear what he has to say about why suddenly masks do work. They didn't work initially, but now they do. And just in case you're not aware, there's a bunch of scientific studies showing absolutely no evidence that masks work to stop the spread of viruses. CDC's own study, I think, from May, so even after this, found the same thing for influenza. No evidence whatsoever that supports basically that they work. They don't stop to spread viruses. At least that's what the scientific studies up until May said. And this is, keep in mind, this is in April. So he's still going off those scientific studies. But apparently something's changed. So let's just let him explain.
It's a great question that you ask. It's a fair question that you ask. I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms.
Okay, so you guys just heard that. The reason Dr. Adams here is telling us we need to wear masks now, and this is in April, is because asymptomatic people are spreading it. This is in April. So let's just go directly to the World Health Organization. And this was, I believe, after April. I think this was in June. This is on my BitChute. I've got it up here in case they rip it from YouTube. But yeah, this is June. This is Maria Van Kerkhove, World Health Organization experts. Let's just get the full context. Watch the whole video here. It's short. Well, at least watch the whole introduction. It takes a little while for her to get to the actual point, but she's talking about asymptomatic and pre-symptomatic. Same exact thing that Dr. Adams was talking about. So let's see what she has to say. He says significant evidence that asymptomatic and pre-symptomatic can spread the virus. That's the one reason you need to wear masks, guys. Now listen to what Dr. Maria says. World Health Organization. Experts. Top experts. So-called.
So there's a couple of things in the question that you just asked. One is the number of cases that are being reported as asymptomatic. And so we hear from a number of countries that X percentage of them are reported as not having symptoms, or that they are in their pre-symptomatic phase, which means it's a few days before they actually develop severe symptoms. In a number of countries, when we go back and we discuss with them, one, how are these asymptomatic cases being identified? Many of them are being identified through contact tracing, and so which is what we would want to see, in that you have a known case, you find your contacts, they're already in quarantine, hopefully, and some of them are tested, and then you pick up people who may have asymptomatic or no symptoms or even mild symptoms. The other thing we're finding is that when we actually go back and say how many of them were truly asymptomatic, we find out that many have really mild disease, very mild disease. They're not quote-unquote COVID symptoms, meaning they may not have developed fever yet, they may not have had a significant cough, or they...
Meaning, in other words, guys, they may not actually be sick. There's another word for not having symptoms is you're not sick. Anyway.
They may not have shortness of breath, but some may have mild disease. Having said that, we do know that there can be people that are truly asymptomatic and PCR positive. The second part of your question is...
It's important to note, and PCR positive actually still doesn't mean you're actually sick, so you can be not sick and test positive. You can actually have the quote-unquote virus and not test positive. It has something like up to a 90% false positive ratio. I don't have it up in my tabs here, but there's over and over, it's been shown, it's been admitted, the PCR tests are not proof that you're sick. They also test for any coronavirus, not just this one, so you could be sick, but you could be sick with the common cold. You could just have, the antigen tests are even worse. Won't even get into that, but just notice that even in what she's saying, she's basing whether or not someone is sick based on do they test positive with the PCR test. They were not designed to test for viruses. On and on. The reasons that the PCR tests are inaccurate are abundant, and that would be a whole video just to get into the PCR tests. Needless to say, just wanted to point that out. PCR tests do not actually demonstrate that you're sick. So some of those people may have the so-called virus. Some quite clearly do not, based on their own admissions. So what she's basically saying is some people who are not sick have tested positive with a test that is very highly inaccurate. So it's still not a confirmation. Just wanted to make sure in case any of the listeners here are not aware of the high rate of false positives with PCR. Just wanted to point that out. But moving on, let's just go with it and just pretend, and maybe in some cases these are actually asymptomatic carriers, which in any other disease you call those people not sick. If you get a virus but don't come down with the symptoms of the virus, that's your body's fought it off. Everyone carries virus in their body at all times. This is normal. If you don't have symptoms, you're not sick. That's how things have always been. Asymptomatic people are simply people who are not sick. Anyway, so some of the people who are not sick are actually testing positive, and they still might not be sick. So anyway, some might actually have the virus. That doesn't mean they're sick. They might have actually fought it off. Anyway, moving on. All that aside, PCR test, highly inaccurate, and let's just move on with Dr. Maria. Get to the good stuff here.
What proportion of asymptomatic individuals actually transmit it? So the way that we look at that is we look at, these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare.
They are not finding secondary transmission. It's very rare. Asymptomatic people do not spread the virus. It's very rare, she said. That's her quote, not mine. They've been doing careful contact tracing, detailed. They're watching close, and yet they're not able to find asymptomatic people spreading it. Very rare. Very interesting, considering Dr. Jerome Adams, Mr. Surgeon General over here in the U.S., is telling us all this is the reason we have to wear masks, because so many asymptomatic people spread it. So the studies show in April, apparently, but come June, all the studies actually show that they don't. So who do we listen to, the health organization or the health organization? Which health organization shall you listen to?
And much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward. What we really want to be focused on.
So it still appears to be rare. It appeared to be rare in the past, apparently, and it still is rare now in June, and I've covered in my blog, there's been actually more studies since then. I covered at least one of those that found the same thing, so it's not isolated. She herself says the studies that have been published show this, and on top of that, people they've been watching all around the world are also finding the same thing, and those are not published studies. So you've got published studies, you've got the WHO's own research, or their own, I guess you could say, collection of research that's not in published studies, all points to the same thing. There's been studies since then say the same thing. Asymptomatic carriers don't spread the virus, or it's extremely rare, very, very rare. So why in the heck is this Mr. U.S. Surgeon General here telling us that because of asymptomatic is the reason we need to wear masks? Your good old instruments of freedom. You gotta love that. Got to love that. But things get even better, so that's just maybe one reason as to why you maybe shouldn't listen to this joker here who says that this dehumanizing muzzle is an instrument of freedom. This is very reason for you having to wear one. It's not existent. It's based on, we don't know what it's based on, but it's not based on the studies that the World Health Organization has been following. I'm sure they can pull some other studies out of their hat. They're really good at that, but even here, and this is Governor Newsom, Gavin Newsom of California. This, I think, was from December 2nd or December 3rd here, Los Angeles time. So, you know, the dark winter's upon us, and it's really important to wear that mask. Slow the spread, even though it doesn't work to slow the spread. Do it anyway because we say so, and gotta have lockdowns and dark winter arriving. And let's just hear what the governor says. This is pretty funny here, so I thought it was worth playing.
We'll start, as is familiar, with case numbers that we're reporting from the last 24 hours. You can see that yesterday we're reporting 18,591 new cases of COVID-19.
Your underarms are under attack. Harsh deodorants are bullying your body and choking your pits.
Sorry about that, guys.
That's an average now north of 15,121.
So just like Biden, just like the Surgeon General, just like the media, he's pushing on this. He's focusing on these high cases, and cases that are derived based upon a highly inaccurate test.
Day average, the highest we have seen since the beginning of this pandemic. The effects of Thanksgiving, they have not yet been felt. They will be felt in a number of weeks. Dr. Fauci, I think, said it best. He says we should anticipate a surge on top of a surge.
So in case you didn't hear that, here, let's play that again. This is...
He says we should anticipate a surge on top of a surge.
A surge on top of a surge, and the Thanksgiving, we haven't felt those ramifications yet. We're going to feel those in the next several weeks. It's going to be a surge on top of a surge, just in time for Christmas. So we got to lock everyone down for the next big holiday, just like we did with Thanksgiving, but it didn't work. Yeah, he had a bunch of pretty much... not a ban on Thanksgiving, but this stay-at-home orders. Gotta have less than 10 people if you meet up in public and 6 feet away, and wear gloves when you cut the turkey, and on and on and on. Can't go in the house unless, 2 hours apart for blah blah. Just on and on. It was really ridiculous, and it clearly didn't stop anything, but apparently it didn't start anything either. We haven't even felt the ram, but we're gonna feel them later. In a few weeks, just in time for Christmas, just in time for us to lock down another holiday. Convenient how that works. Every holiday, starting with Easter, see, they did the same thing with Easter all the way back in April. Lock everyone down for Easter, get everyone all scared. Anyway, he's gonna call for even more lockdown. We're already on curfew here in California. Already got 10 p.m. to 6 a.m. curfew. Already got lockdowns in effect, already got businesses closed down, and he's going to call for even bringing back even harsher lockdown measures. Check it out.
We've seen death rate increase significantly over the course of the last number of weeks. Just take a look at this slide. A month ago, on November 2nd,
oh, deaths are rising so fast. They're still not any higher than last year, but
this pandemic. In the last 24 hours, similar to the previous 24 hours, we've reported back-to-back days.
Fear, people, fear. Fear.
Deaths. Just in the
so
last
many deaths, fear.
Days, close to 1,000.
Be terrified. Do what we say. Wear a mask. Slow the spread. Fear.
The bottom line is, if we don't act now, our hospital system will be overwhelmed. If we don't act now, we'll continue to see a death rate climb.
Oh, if we don't act now like we did all those other times that didn't do jack squat, it's gonna be bad. It's gonna be too much for us to bear. Like everything that we did in the past apparently didn't work, because here we are repeating history, but let's do it again. This time it's gonna work. Makes so much sense. These tyrants just make so much sense. It's pretty hilarious.
More lives lost. And that's why today we are pursuant to the blueprint we put out some 14 or so weeks ago, pulling that emergency brake. We've done it sequentially over the course of the last number of weeks, but we're doing it in a much more broad and much more comprehensive way today. We're announcing and introducing a regional stay-at-home order in the state of California, fundamentally predicated on the need to stop gathering with people outside of your household.
So that's what it is, a new order. Region-wide to stop gatherings. It's bad for people to be with other people. Stay home, stay alone, isolate yourself, wear your muzzle, dehumanize yourself, no social contact, and trust the government, and just have hope in that vaccine. It's coming, guys, and don't worry about the people who tell us what we have to do, and please don't scrutinize them because, well, they break their own laws. Yep, that's right, AP, December 2, hilarious. They published this piece literally the day before he made that announcement of the new order, but he was already not following his own previous, less strict orders. Check it out. This is just getting to the point. The hypocrisy is really overwhelming. Their messaging has been clear, the AP writes. Wear a mask, stay 6 feet apart, and most importantly, you heard it right from him, stay home. Gotta stop those gatherings. Gathering of people, bad. Gotta be isolated. Gotta be home. Or outside, and not at home if it's Thanksgiving. Anyway, but Their actions aren't living up to the rhetoric, creating a real political problem for some of the most vocal leaders in California's fight to contain the CV. First came Governor Gavin Newsom, who we just heard, who won plaudits for issuing the first statewide stay-at-home order in the U.S. all the way back in March. Way to go, Gavin! Way to go! First tyrant to pull out. Oh yes, great, great. New York was, really close. They're really in a match there. Him and Governor Cuomo in New York. They're having this competition. Who could be the first to break out the tyranny when these new agendas get rolled out? Anyway, he broke the state rules when he and his wife were caught. Wait, did I just read that right? He broke the state rules that they're not really state rules, they're executive orders that came straight from his office. So he broke his own order when he and his wife were caught dining with 10 others, and I've read somewhere else that it was over 12, but at least 10 here they're saying. Dining with 10 others at the posh French Laundry restaurant in Napa in early November. One of the most expensive restaurants in the world, while his constituency are having their own restaurant shut down and they're going hungry, or they're at least running out of money, going under, losing their businesses because of his lockdown orders. And yet one of the most expensive ones in the world is open. Maybe it's open because he likes to dine there, him and his political buddies. Anyway, he was dining there with lobbyists and others from numerous different households. Oh no, broke another rule. Supposed to only be with people of your own household, or keep it to 2 households, or maybe 3 household max, but he was with like 10 different families. Anyway, they're sitting close together, maskless. Right. Wear a mask, slow the spread, unless you're me. And you don't have to wear a mask, and you get to go to all your favorite restaurants, because we leave those restaurants open for us, and we can sit as close together as we want. And anyway, on and on. He's not alone, so I'm not gonna get into that, but you can check it out. It's called "Politicians Eat Their Own Words After Dining Out." I don't know if he's actually eaten his own words. He might have issued an apology. I'm not sure. Maybe it says down here. I'm not seeing it. He may have apologized, but superficial if he did, because he hasn't rescinded his order, and he clearly has no need to follow the rules. So maybe it's just a virus that affects us little peasant peons and not the rich ruling class. I'm not too sure what's really going on, except for a whole bunch of tyranny and a whole bunch of hypocrisy. But that's just government for you. So I think that's all I got for you today. I will add, he has a winery, and the winery, his own personal winery, is open, but all the other wineries in California are closed. And churches, not allowed to have church services here in California. That's been that way for months. And strip clubs, though, they're so essential. Strip clubs are essential. Churches are non-essential, and wineries are non-essential, except for his winery. His winery's essential, of course, because it's his, and he should be able to do whatever he wants. So rules for thee, but not for me. And when I say me, I'm not talking me. That's the politicians. If only it was that way for us. But it's not, because we're not the predatory, rich ruling class. We are the peasants. We've been made peasants because, well, that's a whole nother story for a whole nother post. But because of the same bankers that are behind this whole agenda that's being carried out by little puppets like Mr. Newsom, who get to give themselves exemptions whenever they want, that's why we're where we're at, and it's been the biggest wealth transfer in American history. This whole so-called pandemic has been used as cover for wealth transfer to folks like him and big tech and politicians and bankers and big corporations and on and on. Oh, the ruling class, they get richer. Peasant class, we get poorer. That's what's really going on here, and all the while we have to lock down and dehumanize ourselves and wear a mask and muzzle up, guys. So hope you're doing good out there. And that's all I got for today. I'll be back with more videos soon. Thanks for staying with me. Hope you found the information useful. If you like it, share, subscribe, give the video a thumbs up. There'll be a link for donating if you want to send over some Bitcoin. Appreciate it. And till next time, this has been Jason. Have a good one, guys. Peace.